Tomorrow, an FDA advisory panel is poised to consider COVID-19 booster shots. The CDC will meet next week. But this is far from a done deal at this point.
So given that, we really want to focus in on the science at the center of the debate. And here to answer some of the questions is Dr. Todd Ehler, and you know him. He's been with us throughout the pandemic, Director of Infectious Diseases at South Shore Health. Dr. Ehler, it's great to see you. So let's start with this. What is the disagreement here? What are you watching for tomorrow?
See, Ed, here's the issue. There's not a unified consensus amongst the scientific community. There are experts that feel that these vaccines so far are really still protecting so well against severe infection and critical illness that there's no real need for a booster at this time, while others are seeing more and more vaccine breakthroughs. And we know some of the Israel data that shows if you boost, you may be able to get that effectiveness back up to that 95% range. That's really the controversy.
I want to talk about some of the data you just mentioned there. Pfizer's late stage trial of about 4,400 volunteers showed the protection from 2 shots dropped to about 84% after 4 months. We should note that was before Delta. Well, data from Israel's recent booster rollout showed a 3rd shot put effectiveness back at 95%. So what do those results add to the argument over whether the time is right for boosters?
Right. So, Jessica, the first thing I want to say is that first study you commented was pre-Delta. So I really want to focus on the Israel study. Now, the Israel study showed significant effectiveness with that booster, but it was only a 12-day study. So we really only know the duration up to that period of time. Now, they looked at about 1 million people, and they were 60 years of age and older. So what it really tells us maybe is that we should think about boosting perhaps the elderly and the more vulnerable populations first. I think it's possible that that's where the FDA may go. But again, we're just not sure. The scientific community remains divided about boosters.
Okay. We talked about a lot of this has to do with Pfizer. What about Moderna and J&J?
Good question.
Okay, right. So basically, tomorrow's FDA meeting is going to be solely about Pfizer. That's the question about that booster. Moderna and J&J are waiting in the wings. They've submitted their information to update their emergency use to include the booster, but tomorrow's meeting will only be focused on Pfizer. I will tell you that sooner than later, we are going to get some important information about the J&J clinical trials on effectiveness of their early boost at 2 months and their later boost at 8 months. So stay tuned for that.
Dr. Chi, now some doctors, including some on the FDA panel, have said that the real solution is not boosters. It's ending what they call the pandemic of the unvaccinated. That's the phrase that they use. So what's your take on that?
I'm really happy that you asked that, Ed, and you commented on it. It is true. Really, to change the arc of this pandemic, the key is not going to be about boosting. It's about getting the unvaccinated vaccinated. And I have to tell you, I'm seeing patients every single day with severe and critical illness, and they are mostly unvaccinated. I just saw a patient today that had been hospitalized a couple of weeks ago with severe COVID and is now back in the hospital with a severe COVID complication. And when I talked to this person about vaccination and the reasons why that this patient wasn't vaccinated, a lot of it had to do with mistrust. And even after going through this severe illness, it's not clear that this person would be vaccinated again. So it really makes me feel for the vulnerable people that are unvaccinated right now in America. And I just wish that we had a better way to communicate the importance and to convince them that this vaccine is safe and effective.